This is Eric Michaels, and you have tuned in once again to the eHealth Radio Network and the Plastic Surgery Informational Channel. Make sure you connect with us on Facebook to receive the latest programming for your convenience at eHealth Radio. Today we are visiting with Dr. Adam Schaffner, a fellowship-trained New York City plastic surgeon who specializes in aesthetic plastic surgery of the face, breast, and body. He is a clinical assistant professor at Weill Cornell Medical College in Manhattan and has appeared on ABC's Good Morning America, CBS News, and Fox News as an expert on plastic surgery. Dr. Schaffner, welcome to eHealth Radio.
Thank you very much. It's a pleasure to be with you.
Yeah, likewise. So, Dr. Schaffner, plastic surgery is certainly a popular thing among women. It appears that more men are getting plastic surgery and having cosmetic procedures such as Botox. Is this true?
That is absolutely correct. So plastic surgery amongst men is on the rise, has been for the past few years. More men realize that there are many advantages to having plastic surgical procedures that help improve one's appearance. And it doesn't have to be the traditional surgical procedures that we all think of. It can be things, as you suggest, like Botox, or what people affectionately call Brotox, which is basically just Botox in areas of the face that will help smooth those wrinkles that develop with age and make someone look a little bit younger and more relaxed and rested.
What is the latest in chin implants, and why is everyone wanting a strong jawline?
Well, the number of chin implants which have been placed in recent years has continued to increase, and I think the reason being is because people want that strong jawline, which is associated with leadership. If you look at the majority of chief executive officers of major corporations and even presidents in the United States and prime ministers and other heads of state who are male, they generally have very strong jawlines. And so people, I think, are interested in having a strong jawline to appear as if they are strong themselves. In addition to giving someone a strong jawline, chin implants also can help balance the face so that the lower third of the face is balanced with the middle and upper third of the face, and this is important in both men and women. Chin implants can also have the effect of balancing out somebody's nose that may be larger than they desire.
I hear rapid recovery breast augmentation allows you to enlarge breasts and go back to work the next day. How can that be?
Well, that's absolutely true. So rapid recovery breast augmentation is a breast augmentation or breast enhancement surgery which enlarges the breasts under intravenous sedation. No general anesthesia is required, and so while the patient is comfortable and will not have any memory of the procedure, they don't have to go completely out. And as such, the risks and recovery period associated with general anesthesia are not something that the patient has to worry about, and therefore they're able to recover much more rapidly. In most cases, they're able to go back to work the next day. They feel a little bit of pressure in the chest region, but as far as their ability to function in the workplace, as long as they're not doing any heavy lifting, bending, or straining, they can go back to work the next day.
Today we are with Dr. Adam Schaffner, a fellowship-trained New York City plastic surgeon who specializes in aesthetic plastic surgery of the face, breast, and body here on eHealth Radio's Plastic Surgery Informational Channel, a part of the eHealth Radio Network. Now, Dr. Adam, it seems fat can not only be taken out but can be put back in to help improve one's appearance. How exactly does that work, and how can liposuction be good for your health?
Well, in order to go ahead and remove fat and use it, you have to process it in a certain fashion. And assuming that the fat is taken out by traditional liposuction, that's been performed specifically with transferring that fat to another area of the body, that fat can very much improve one's appearance, whether it's to restore some volume in the face that's been lost with age, it may be to increase one's breast size, or to enhance one's buttock size. And so there's many different uses for fat, and all of it can be of benefit to the patient's appearance. In addition, there was a study that was released recently that showed that people who have there was a study that was recently released that showed that people with elevated triglyceride levels, as well as white blood cell counts that have been elevated, can actually be helped as the triglyceride levels and white blood cell counts have been shown to go down after someone had liposuction. So not to say that liposuction is a primary treatment for people who have elevated triglyceride levels, but it's an added benefit.
Nowadays, it appears a lot of doctors and some people who aren't even doctors are performing cosmetic procedures. What advice would you give to someone who is considering plastic surgery?
Well, I would advise people to make sure that their plastic surgeon is in fact a plastic surgeon, and that their doctor is someone who is experienced in the procedure that they're interested in having, that they've performed many of them, asked to speak with patients who have had that procedure performed by that doctor, look at before and after photographs of the patients who have had that procedure by that doctor, and see whether or not you like the way that before and after photos look. And if that's something that's consistent with that individual's taste, then that may be something that the prospective patient would want to proceed. And of course, make sure that the doctor is board certified in the appropriate related specialty relevant to that area, and make sure the doctor has hospital privileges for the procedure that they are going to be performing. And if they have an academic appointment where they're teaching other doctors how to perform plastic surgery, that's an added benefit as well. You can also check the state data bank for any malpractice suits, that they're appropriately licensed. And of course, you have to like that doctor.
Where can our listeners find more information or be in contact with you online if they have any questions?
They can reach me at 212-688-6600, and listeners can also go to www.drschaffner, that's DRSCHAFFNER.com. More than happy to answer any questions.
Very good. And Dr. Schaffner, in conclusion, what one thing could you leave with our listeners in form of a tip in conclusion?
If you're interested in plastic surgery, be sure to do your homework. Make sure your plastic surgeon is a plastic surgeon.
Sound advice. We've been talking with Dr. Adam Schaffner, a fellowship-trained New York City plastic surgeon who specializes in aesthetic plastic surgery of the face, breast, and body. He is also a clinical assistant professor at Weill Cornell Medical College in Manhattan. And the website of reference, once again, is drschaffner.com. Dr. Schaffner, thanks so much for being with us today on eHealth Radio.
Thank you very much.
You are very welcome, and this has been Eric Michaels, and you've been listening to eHealth Radio and the Plastic Surgery Informational Channel, a part of the eHealth Radio Network. We do thank you for listening, and until next time, enjoy.